I'm Hannah's mother. I was banded back in November of 2004, and after losing 100 pounds very successfully that first year, Hannah, who was 12, had the same problem I did with uncontrollable hunger. We were never full. She was 5'5", 289. She was wearing size 28 clothes, and at 12 years old, your life is pretty difficult. We had to go to children's hospitals because she had extremely high blood pressure. She had urinary problems just from the weight. We had so many issues that were nothing but the obesity, and they just started perpetuating worse. You know, the diabetes was coming. Her blood sugar was high. When she was 12, she jumped off of a 3-foot ledge and broke 2 bones in her ankle because the weight. Her bones were fine. They've tested her bones. It was just the sheer weight. When she was 5, she fell full body force and broke the bones in her arm, just the weight. The band was such a successful tool for me. I had started talking to Hannah about it, and she was like, I want no surgery. 8 months, 9 months into my band, she started noticing the change in my life. I dropped, like I said, that first year I dropped 100 pounds. I'm down 155 total. She started talking about it a little more, so then I started broaching this subject with my husband. We talked to our medical, we talked to everybody, and nobody would even touch her at 12. They said when she's 14 she could have a bypass. I knew that wasn't. I was like, what? You'll cut her insides when we have this successful tool. So I started on asking Dr. Kuri, and his first answer was no. I knew there were doctors that would do it, but I didn't want them. I wanted Dr. Kuri. I knew he would be right. Dr. Kuri, after talking to her, said, okay, you can bring her down and we'll see, because I was coming for the bash.
I went in to talk to him, and then we talked for about half an hour, and then I guess he was convinced that he'd do it.
Everything is normal now.
It's a lot better. Like, in soccer, this is what they use in the paper. In soccer, I would just stand there and wait for the ball, but now I actually go for it. And I don't get tired after running once down the field. I can run up and down.
Her blood pressure's fine now. She can do things now. She's off and running all the time, not just sitting there. It's so cool. Both our lives. My mom, she was like, I'm so glad you're taking Hannah down. I had a few people that really gave me a hard time about getting a 12-year-old surgery. But now, people that gave me the hardest time come and say, you're so lucky you did that for her. And I said, it's just a blessing.
But a lot of my friends' parents or grandparents are getting the surgery now that they saw my success.
Yeah. If a parent doesn't have a weight problem, they're going to do this for their child. I think a big thing would be to make sure you understand it then. The band did control the amount she ate, and so it was more making sure that she was making the right choices first, you know, getting her proteins first and her veggies, even though she might not feel like eating them, and understanding the ice cream still goes through. And so as a parent, you have to know all the cheats with the band, all the problems, and what to look for. The biggest one is to talk to your child and make sure they understand. There was some rough moments when the things she couldn't eat that she wanted to eat, and it was hard for her to understand not being hungry. And I knew that from my own experience, that's the weird feeling. You almost go through a slight depression when you lose your buddy food, you know, and so talk to the child and let them totally understand the surgery. Plus, Dr. Kuri's site is really good to see what the surgery is about. We are open to talking to any parents that want to look into it. Go to your doctor first. Make sure there isn't an outline. They did all the studies with Hannah at the Children's Hospital. They checked her thyroid. They checked everything, you know. Those are just some of the things to look for. And then find the right surgeon, and I think that's Dr. Kuri.